make mistakes. We won't be perfect, but when we make a mistake, we'll fix it very quickly. So for example, with USAID, one of the things we accidentally canceled very briefly was Ebola, Ebola prevention. I think we all want Ebola prevention. So we restored the Ebola prevention immediately, and there was no interruption.
That's not true. Today, Donald Trump's top campaign donor claimed during a weird, filmed for TV cabinet meeting that although he had accidentally, in his role as Donald Trump's top campaign donor, ended all Ebola prevention efforts of the U.S. government, after they realized that's what had happened, it was restarted. It was just a very brief interruption, and it all could, or not even an interruption, it was very briefly stopped, but then restarted without interruption. People who actually work on these matters for the U.S. government and in this field say none of this is true. Public health experts, including current and former USAID officials, say that the Ebola prevention efforts were hobbled, that they've not been restarted. In 2014, you might remember there was an outbreak of Ebola in West Africa. Doctors from the United States went to countries like Guinea to go track cases and treat patients. A doctor named Craig Spencer was one of those doctors who responded to that outbreak, and he became the first person in New York City to test positive himself for Ebola in October 2014, after he was abroad treating Ebola patients in Guinea with Doctors Without Borders. Ebola has a really high mortality rate. It kills more than half the people it infects. In Dr. Spencer's case, he had 19 days in the hospital, but he survived. Today, he wrote this in response to Elon Musk's remarks about Ebola prevention being accidentally stopped, but then started back up again with no interruption. He said, quote, "On January 29th this year, Uganda reported an Ebola outbreak. Normally, the U.S. would have quickly sent one of our Ebola experts to help the response. But this time we didn't, because we couldn't, because this administration wouldn't let them go right when this outbreak was declared. Normally, the U.S. would have helped set up border screening and other measures on the ground, but this time we didn't. Normally, we would have spoken with the WHO about helping end the outbreak, but this time we didn't, because CDC staff weren't even allowed to talk to them." Joining us now is Dr. Craig Spencer. He's Associate Professor of Health Services Policy and Practice at Brown University School of Public Health. He's also the New York City emergency room doctor who survived Ebola after treating Ebola patients in Guinea with Doctors Without Borders about a decade ago now. Dr. Spencer, I really appreciate you being here tonight. Thank you.
Good to see you again.
So it's always good to see you because you had Ebola. And so anytime that I see you, I feel like I have hope that these sorts of things can be survived, these horrific diseases. I have to ask what your reaction was to seeing Elon Musk today bring up Ebola unprompted, laugh about it, and then suggest that while he had accidentally cut off all U.S. government efforts to combat it, everything was fine now because it had all been restarted without interruption.
Well, Rachel, I was remarkably confused because for the past month, I have been talking to people who normally would have responded to this Ebola outbreak in Uganda, the Marburg outbreak in Tanzania, and guess what? They didn't. For the last decade, I have followed every single outbreak of viral hemorrhagic fevers like Ebola. I know everyone that is doing this. I know where they're responding. I know the people in Uganda at the Ministry of Health. I've heard from people who normally would be supported by our country, by our government, to set up border screening, to do the contact tracing on the ground. They're not getting paid. Countries are asking them to work for free because USAID normally would have supported them. Here in this country alone, we normally would have sent people almost immediately once these outbreaks are declared. Guess what? We didn't do this. And the result is right now, people around the world are looking to the United States saying, what are your commitments? What is true about your support? What Elon Musk said today was just categorically untrue. We did not get rid of Ebola prevention and then put it back in place. Elon Musk and Doge were responsible for actively and actually stripping off the letters of the USAID, the agency, from its headquarters in Washington, D.C. On the first day of this administration, Donald Trump signed an executive order to pull the United States out of the World Health Organization. And just very recently, hundreds of CDC workers, those frontline doctors and epidemiologists who would be responding to outbreaks like Ebola abroad, Ebola in the United States, and other infectious threats that you just highlighted, 750 of those people were let go. Regardless of what Elon Musk and others say, we have set ourselves up to be very sorry for an infectious threat. Maybe next week, maybe next month, maybe next year. But I've been saying over and over again, we will regret this.
Craig, some of this drama is playing out right now as we speak in Washington. A federal judge ruled yesterday that the Trump administration had until midnight tonight to restart foreign aid funding that had been appropriated by Congress, that they were legally required to be releasing, and that those funds needed to be released, and that process needed to be open by midnight tonight. It went to an appeals court this evening that said the judge's ruling stands, and effectively that those billions of dollars should be released by midnight tonight. The Trump administration is taking it to the Supreme Court. They're also now saying that those funds are no longer under review, but that they are formally canceled. They will never be restarted. And they are, in other words, pulling out every possible stop up to and including a trip to the Supreme Court tonight to try to say that USAID is gone institutionally, effectively. So that whatever funding programs they want to say, whatever programs they want to be able to say they restarted, USAID won't be there to effectuate any of this stuff. Can you help our audience understand the difference between funding in the abstract and having an agency that actually effectuates the program that funding is for?
Absolutely. What is happening right now is they're trying to play out the clock to the point where USAID officials and funding, all of these other things that we've built up over decades to do the incredible work of disease surveillance and responding to Ebola outbreaks and every other thing like HIV around the world, they're trying to wait until all of that is completely destroyed so it cannot be put back together again. Now, let me be very clear. There are reasonable reasons for people to, think that USAID and the WHO and other agencies should be reformed. But we should not do what we did overnight. We have left Americans stranded abroad. We have left 20 million people around the world without access to HIV treatment, which they were recently getting through PEPFAR, which is largely supported by USAID. Without these services in place, people around the world are less safe and less healthy, and that increases the risk to people here in the United States. USAID's tagline has been from the American people, but in reality, it is for the American people, and everyone needs to understand that threats and health problems in other places can soon become problems here without the USAID, without funding those incredible people that are selfless and have dedicated their professional life to this work, without people from the WHO and CDC. We will all be less safe. And again, I promise you, we will regret this.